Okay, so here's our overview of the ear. The ear can be divided up into three sections. We're going to start with the outer ear, and you can see one component of the outer ear is this kind of shell-like portion. It has a couple of names. Sometimes it's referred to as the auricle, sometimes it's referred to as the pinna. Okay, so basically what this structure is designed to do is to be a funnel. So as the sound waves are coming in, it's supposed to funnel them into this passageway, okay, which we'll talk about in a moment. Now, in humans, we've kind of lost the ability to turn our ears. The muscles that used to do that for us, we don't use those very much anymore. And most people can't move their ears at all. If you see a deer out in a field, you can see how they twitch their ears around, or a dog. When they're trying to focus in, they kind of use their ears like antenna to pick up where the sound is coming from. We have to turn our heads now. Okay, but when the sound is directed in, it's going to move through this passageway, which is also part of the outer ear. And this is the external acoustic meatus. Okay, and again, this is just a conduit passageway to get the sound waves to the next section, which is the middle ear. Now, the middle ear is where we start with the actual vibrations associated with sound. Okay, so the first structure that's going to vibrate is this structure in here, and this is the tympanic membrane. Okay, now the tympanic membrane, the layperson's term for it is the eardrum, and it's actually not a bad term to use, because even though it's not correct, because the structure does vibrate just like the surface of a drum. Okay, so the sound waves hit it, the tympanic membrane starts vibrating. That causes vibrations to move through a set of small bones, the smallest bones in the body. And those bones that pass through the middle ear are the ossicles. Okay, they're named ossicles as a group. Their individual names are the malleus, the incus, which is here, and then we have the stapes, which for some reason has tape all over it, but it's supposed to look like a little stirrup. So I'll show you those on this other model because you can see them a lot more clearly. Here's the tympanic membrane on this model. This is really such a beautiful model because this is actually how the tympanic membrane should look if you were looking in through an otoscope to check out somebody's ear. It should have this nice indentation in it, or concavity, that you see here. Okay, and that pink line that you can see looking at it is actually part of the malleus. Okay, so this is the part that is attached to the tympanic membrane. So as soon as this starts to move, the malleus starts to move in sympathy with it. Okay, so the layperson's term for the malleus is the hammer. Okay, because some people think it looks like a little ball-peen hammer. Then we have the incus. The incus is Latin for anvil. Okay, so if you've ever seen the old blacksmith working at an anvil, that's the shape that you would see. Then I'm going to take this piece off so we can see that beautiful stapes. And stapes is Latin for stirrup. So you can see how it has that real stirrup look to it. Okay, so in addition to vibrating in sympathy with the tympanic membrane, the ossicles also amplify the sound. Okay, so the vibrations actually get stronger as they go through this set of three bones. Okay, now I'm going to switch back to the other model for a second. The middle ear should be an air-filled space. Okay, and the pressure in the middle ear is kept consistent with atmospheric pressure through this tube, which is the tympanopharyngeal tube. okay, or auditory tube. And when your ears pop, if you're going uphill or downhill, that's when air is moving through this passageway. Now, if somebody has an ear infection, a middle ear infection, that's when they have fluid accumulating in this area. Okay, so they may not hear as well because the fluid is going to be pushing against the tympanic membrane. It's going to be around these ossicles, and so the vibrations aren't going to be as strong, and they're going to get kind of diluted a bit by the fluid. Okay, and also this is again what the shape of the tympanic membrane should be. If you were looking in and somebody had a middle ear infection, this might be bowed toward you or have a little more of a convex shape. Okay, it may not look as clear. It may look cloudy behind it. You may be able to see pus in there. Sometimes it will even have some bleeding associated with it. If there's enough fluid pressure in the middle ear, the tympanic membrane can rupture, okay, which is very unappealing. Okay, all right, we'll come back to this guy in a minute. From the middle ear, we transmit our vibrations to the inner ear. Okay, and the inner ear is where we start to see the other special sense associated with the ear structures, and that is balance. So basically, as you go past the stapes here, all of this material on the inner ear is associated with equilibrium. The cochlea over here is what's associated with hearing. Okay, so we have the vestibule as our main area here. Okay, that's kind of between these three ring-like structures that you can see over here and the snail shell. Okay, the three ring-like structures that you can see are the semicircular canals. You can see that they're arranged in the basic planes that we talked about of sagittal, frontal, and transverse. Okay, and so this is what gives us information on changes in head position, okay, in those planes. Okay, and these two structures, the vestibule and the semicircular canals, again, are associated with equilibrium. The cochlea is associated with hearing. Okay, now if we opened up the cochlea, okay, and let's just look at these structures again. Here's the stapes. Here's the vestibule in here, in this area. Here are the semicircular canals, and here's our cochlea. If we open up the cochlea, we're going to see that there's a pretty amazing structure inside. Okay, now this, let me just hold this on for a second. When we're looking at the structures like this, we're actually looking at the bony labyrinth, and the bony labyrinth is what's basically the shell that forms all of these structures. Okay, so just like a chicken egg has a shell with material inside, membranes and other fluids inside, we have the same kind of situation going on with the ear. Okay, so these structures that we're looking at are the bony parts. If we open them up, we get to the membranous labyrinth. Okay, and inside the cochlea, you can see we have this kind of spiraling structure here, which is the spiral organ of Corti. Okay, and that is the structure that actually has the mechanoreceptors that allow us to hear. Okay, and both the equilibrium portions of the ear and the cochlear divisions have neural impulses that they need to send into the brain. So you can see here's the cochlear division, And here's the vestibular division, much smaller. Okay, and they come together to form cranial nerve 8, the vestibulocochlear nerve. Okay, so that is our basic structure of the ear. And there's a shot of the bony labyrinth to take us out.